It was shocking to hear that an oncologist told a patient recently diagnosed with breast cancer to chop off both her breasts. I found this very difficult to accept. Why? Let's explore this issue together, shall we? In healthcare today, doctors practice evidence-based medicine. What does this mean? Researchers study outcomes of various forms of treatment. Recommendations are then made from data comparing different forms of therapy. Does chop off both breasts constitute evidence-based medicine? Firstly, I would say that as a surgeon, I would never use the phrase chop both breasts off. I think it is insensitive. What about you? Please enter a comment if you agree or disagree with me on this issue. Back to the subject of surgery. The medical term for the removal of both breasts is bilateral mastectomy. It is also commonly known as double mastectomy. If no reconstruction is performed, this may be the resulting appearance. However, following mastectomy, women may choose to have breast reconstruction. There are many techniques to perform reconstruction, but this is beyond our discussion here and will be covered in other videos. Please note that the data shared here is solely for educational purposes and is not intended to replace a medical consultation. Please see your doctor to understand your unique circumstances and for treatment planning. Is bilateral or double mastectomy the best form of surgical treatment for breast cancer, as this oncologist suggests? Let's first explore the evidence, and at the end of the video, I will share my thoughts on why doctors may make this recommendation. Before we move on to discuss whether bilateral mastectomy is the best option, allow me to discuss the options for breast cancer surgical treatment. The first of these is breast conservation treatment. This involves the complete removal of the cancer with a rim of uninvolved breast tissue all around, usually followed by radiation treatment to the retained breast. The operation for breast conservation treatment may be referred to in many terms: breast-conserving surgery, lumpectomy, wide excision, segmental mastectomy, or partial mastectomy. The other group of operations involve mastectomy, which we have already briefly discussed. Here, this is an example of a single-sided or unilateral mastectomy without reconstruction. So, in this video, I shall be presenting data to answer the following questions. Firstly, is bilateral mastectomy the best operation for the surgical treatment of breast cancer, and should a patient accept the recommendation to remove both breasts? I would also be sharing the factors which a surgeon like me would consider when advising on the best option for surgical treatment, and what I would do if a patient came to me for a second opinion. Let us look at the evidence available for the following parameters. Survival rates. This may be viewed as cure rates. Then we can evaluate the local recurrence rates. Local recurrence refers to the reappearance of cancer within the breast or in the skin covering the area that used to be occupied by the breast. Thirdly, we will explore the complication risks associated with bilateral mastectomy. There are other dimensions which have been studied, and I have included them in my other videos, the links to which are listed in the description below. First, let us look at survival rates. While it is not my personal favorite manner of analyzing cure rates, this team of researchers from Stanford University School of Medicine used mortality, or death, as the measure of effective surgical treatment. In 2012, they found that while the use of bilateral mastectomy increased significantly throughout California from 1998 to 2011, this was not associated with lower mortality than that achieved with breast-conserving surgery plus radiation. In fact, if we were to look at the actual data presented in the article, there may be a suggestion that bilateral mastectomy was associated with a slightly increased mortality rate. More recently, there appears to be some data which suggests that in certain types of breast cancer, undergoing a mastectomy is associated with poorer survival. In this study published in 2023, it was found that for women with estrogen receptor positive and progesterone receptor negative breast cancer, bilateral mastectomy was associated with significantly increased risk of breast cancer mortality relative to lumpectomy with radiation. Therefore, with respect to survival, there is no evidence that bilateral or double mastectomy for women who have been diagnosed with breast cancer is associated with improved survival rates. In fact, there may be evidence to suggest that in certain breast cancer types, mortality is increased with bilateral mastectomy. Let's now move on to recurrence. To be honest, I could not search out an article that directly compared recurrence rate between bilateral mastectomy and breast conservation treatment. So I have decided to use the comparison of unilateral or single-sided mastectomy with that of breast conservation treatment. This is a meta-analysis comparing breast-conserving surgery and mastectomy published in 2024. I would like to highlight some excerpts from it for our discussion. A meta-analysis is a statistical approach evaluating the carefully calculated combined outcomes from several studies. This is done to assess if the evidence can be generalized. In this study, it was found that, based on a median follow-up of 29 months, the overall recurrence rate of patients with breast cancer undergoing breast-conserving surgery was lower than that of those undergoing mastectomy. For a longer follow-up period, there was no significant increase in the overall recurrence rate. What about the development of cancer in the other breast? This is medically termed contralateral breast cancer. This research team from Canada found that of women who were already treated for breast cancer, 1.36% developed contralateral breast cancer. So the question to answer in this case would be, should removal of the uninvolved breast, known medically as contralateral prophylactic mastectomy, be recommended to avoid contralateral breast cancer in 1.36% of survivors? In contemplating treatment, doctors weigh the risk-benefit ratio. We now look at the data for surgical complications and compare that with the likelihood of recurrence. Every surgical procedure carries risk of complications. Some have lower risk while others have higher risks. In a review published in 2021, it was found that surgical complications occur in about 51.6 to 56.7% of women who undergo bilateral risk-reducing mastectomy. The complication risks reported in the review just presented is not too different from this 2026 study, which evaluated mastectomy with implant reconstruction. Complications occurred in 58.9% of breasts which were operated on. For women who choose to undergo mastectomy without reconstruction, postoperative complications occur in about 4% of patients. This is significantly higher than for breast conservation treatment, where complications occurred in 1.74% of patients. Apart from surgical complications, there may be quality of life issues related to having mastectomy as well. This may occur in up to 50% of patients in certain domains. This is a study on women who underwent contralateral prophylactic mastectomy, which is the removal of the uninvolved breast at the same time as mastectomy for the breast with cancer. So, to compare the options of treatment in terms of surgical complications. The risk of complications if a woman were to undergo breast-conserving surgery is 1.74%. Since this means that her uninvolved breast would be preserved, her risk of developing contralateral breast cancer is about 1.36%. Should she wish to undergo contralateral mastectomy alone without reconstruction, her risk of complications would be 4.04%, and if she were to choose mastectomy with reconstruction, her risk of surgical complications may be up to 58.9%. More than half the women who undergo contralateral prophylactic mastectomy, abbreviated here as CPM, may experience dissatisfaction with body image. With research data showing risks of complications for double mastectomy far exceeding that for breast conservation treatment, why are there doctors who advise women to chop off both the breasts? In this review of research studies conducted by an international group of experts, the authors made a comment that physicians with a low level of knowledge about contralateral breast cancer or recurrence were more likely to consider bilateral mastectomy than physicians with a high knowledge of the risks. Just to clarify, in the article, CBC is the abbreviation for contralateral breast cancer, and CPM is the short form of contralateral prophylactic mastectomy, which implies a patient would have undergone double mastectomy. Just to recap, The evidence shows that contralateral prophylactic mastectomy provides no survival benefit for women who are at average risk for contralateral breast cancer, which form the far majority of patients. However, there are situations when it would be considered reasonable for a patient to undergo a double mastectomy. If a patient has been tested to be a BRCA1 or BRCA2 gene variant carrier, bilateral mastectomy is a reasonable option. This subject is discussed in greater detail in this video, the link for which is provided in the description below. Still, I wish to remind us that for women at average risk of developing breast cancer, the evidence still suggests that overall survival is not compromised, but may in fact be better with breast-conserving surgery compared with mastectomy. It is because of these recent studies that at the 2025 edition of the St. Gallen International Breast Cancer Conference, an expert panel stated that while they support patient choice in the decision of the type of primary breast cancer surgery, they also believe that patients should be advised that breast-conserving surgery and radiation therapy is usually the best treatment option with comparable or superior cancer control results, less morbidity, fewer complications, and favorable patient-reported outcomes. At the beginning of this video, I started by asking these questions. Firstly, is bilateral or double mastectomy the best operation for the surgical treatment of breast cancer? We have seen from the studies presented that for women at average risk who have early breast cancer, the evidence shows that breast conservation treatment is associated with comparable or superior cancer control, less morbidity, fewer surgical complications, and favorable patient-reported outcomes. The second question was whether there are special circumstances to consider bilateral mastectomy. When a patient has been diagnosed with a BRCA1, BRCA2, or other high-risk genetic variants and has concerns about local recurrence, contralateral breast cancer, and high-risk surveillance, she may wish to consider bilateral mastectomy. The final discussion point on this subject is what I would suggest if another surgeon recommended bilateral mastectomy. If a patient has a family history of breast or other related cancers, it might be useful to confirm her genetic status. The majority of women will test negative for high-risk genes. If so, then the next step is to discuss with your surgeon your eligibility for breast conservation. Most women with early breast cancer will be eligible. This video gives more details. Apart from breast conservation eligibility, you may also wish to go through the risks of recurrence, contralateral breast cancer, and compare that with the risks of the various surgical procedures that are listed as options. Once these essential details are available, a patient can then be empowered to make the decision that best suits her values. Thank you for staying until the end of the video. I hope that the information has been helpful. Please feel free to verify the references presented. The focus of the content in this channel is to empower women with research data and evidence to make decisions about breast cancer surgery that help them live longer and live more. I hope that in addition to liking, sharing, and subscribing, you will also join me in my other videos. Until we come together again, take care.